All right. Good morning, Facebook. It is April 22nd, Wednesday, I think. Wednesday, April 22nd at 11:45 a.m. Pacific Daylight Time. And here we go. Beginning with global figures for coronavirus infections and fatalities, the world is currently looking at 2,592,234 positive or confirmed cases, 181,052 people have perished from the disease. The United States remains by far the worst affected country. We are currently looking at 820,600 positive or confirmed cases, with 45,967 deaths. As usual, these figures are coming from worldometers.info/coronavirus, which is sort of an aggregate website which draws upon many different reports from many different sources to provide these numbers. They seem to update in real time, and there are links you can click to find where these numbers are coming from, but they update very quickly, especially when you're looking at the global figures that are continually fed by the various nations reporting. The United States, most likely in the next, I'm going to predict week easily within the next week, the United States will probably surpass 1 million positive or confirmed cases. Spain is in second place with 208,389 positive or confirmed cases, with 21,717 citizens of Spain having perished. Italy, 187,327 positive or confirmed cases, with 25,085 fatalities. Let's jump down to the United Kingdom, who are looking at 133,495 positive or confirmed cases, with 18,100 deaths in the United Kingdom. So Italy and the United Kingdom, as far as I can tell from these figures, are still both at or slightly above 13% fatality rate. So let's look a little more closely at the United States. Once again, 820,600 positive or confirmed cases, with 45,967 deaths. The state of New York, 256,555 positive or confirmed cases, and they have now surpassed 20,000 deaths. So half, well, somewhat under half, but close to half of all deaths from coronavirus in the United States are within the state of Washington, probably within the state of New York, probably within the New York City metropolitan area, which obviously includes New Jersey, parts of New Jersey. They are looking at 92,387 positive or confirmed cases, with 4,753 fatalities. Looking here at the Pacific Northwest, the state of Washington, 12,282 cases, with a death toll sitting at 682 Washingtonians having lost their lives. I want to quickly look at states where I used to live. Nebraska, 1,722 cases and 38 fatalities. Before Nebraska, I lived in New Mexico. That was back in the 80s. And that was Alamogordo, which is a little Air Force town that seems to be frozen in time in many ways. But they The state of New Mexico, the fifth largest state by area, is looking at 2,072 positive or confirmed cases. 65 New Mexicans have lost their lives to the virus. Oklahoma, 2,807 positive or confirmed cases, 164 fatalities. Well, let's talk about Washington State. Let's talk about Washington State's current status as relates to mitigation efforts. There have been protests all across the country, including here in Washington State. I understand some 2,500 Washingtonians protested in Olympia recently. I don't know exactly what date that was, but on the same day, over 500 people had gathered on one of the main roads in Olympia near the Capitol building. So Washingtonians were showing up in their thousands to Olympia to protest Governor Inslee's stay-at-home, stay-healthy order and all the associated restrictions. Governor Inslee has always appeared to me as a very reactive politician. He seems, just from my observation of the way that he's handled himself, specifically when he was drawing national attention as a prospective Democratic candidate for president. That didn't work out well for him. But he seems very focus grouped in the way that he presents himself and his policies. For instance, while he was running for the Democratic nomination for president, his main central and defining trait was his hate for President Trump. That seemed to be all he felt like he needed to articulate to win enough support to get nominated. Well, how did he react then to the pressure being exerted upon him by those who oppose Washington State's current lockdown? He did react. His current stay home, stay healthy order is not set to expire for another couple of weeks. May the 4th, I believe, is when the current proclamation is currently set to expire. And so, with the developments from the White House, the phased reopening of the country as announced by the Coronavirus Task Force, on the heels of that, Governor Inslee has announced Washington's COVID-19 recovery plan, and he did so in a televised statement last night. This is from Medium.com. Governor Jay Inslee spoke directly to Washingtonians Tuesday evening to lay out his vision for the eventual safe return to public life amid the coronavirus outbreak. Inslee said it is unlikely many restrictions under the Stay Home, Stay Healthy order will be modified before May 4th. Rather, this plan is intended to be a framework for the loosening of restrictions contingent on a steady decrease of the spread of COVID-19. Quote, "It will look more like the turning of a dial than the flip of a switch," Inslee said in the address. He continues, "We're going to take steps and then monitor to see whether they work or if we must continue to adapt. Depending on health projections for the spread of the virus, some distancing restrictions may be in place for weeks or months to come." Quote, "In the coming days, we will receive additional health modeling projecting the course of this virus," Inslee said. "We hope it will give us cause to begin lifting certain restrictions." I hope you guys listening to this have already begun to notice. We hope it will give us cause to begin lifting restrictions. We're going to take steps and then monitor to see whether they work. Projections will probably not allow for the easing of restrictions before May 4th. There's nothing solid in this. Continuing from Medium.com, the recovery plan begins with widely available testing for individuals who may have contracted COVID-19, tracing for those who have come into close contact with COVID-19 positive individuals, and isolation or quarantine for individuals who could transmit the virus. However, a variety of barriers to accessing necessary supplies have prevented Washington from processing more than 4,000 tests a day. For the contract tracing plan to work, the state needs to be processing between 20,000 and 30,000 tests a day. Earlier Tuesday, the government sent a letter to the vice president asking the White House to create a national testing system. Now, it kind of goes on, and I watched the statement myself from Governor Inslee. And what I took away from it was we can simply expect the current state of conditions in Washington to remain as they are. Frustrating to say the least. Now, as this piece mentioned, our governor did send a letter to the vice president, notably avoiding any direct contact with the demon Trump. So I have a copy here of the letter which was sent, dated yesterday. I'm not going to read all of it. I'm just going to go over the parts of it that I believe to be the most salient to the current state of affairs. Dear Mr. Vice President, thank you for your continued open line of communication, which has helped my state in several ways. We share your goal of a safe return to normal social and economic activity over time. Individuals, families, businesses, and communities are counting on leaders at all levels to work together to ensure this process is carried out in a manner that keeps the public safe and minimizes the risk of viral resurgence. And by the way, have you guys been following the national news, where we have people like the head of the Center for Disease Control coming out and saying that in the fall, when the summer warmth has abated and we're going back to cooler conditions, that we will see a resurgence in this, a resurgence which could be far worse than this initial wave that we've seen starting back in February? So the experts from on high are predicting that what we're going to see is that in the fall, this experience that we're all weathering together is going to look like nothing compared to how bad it could be. And there is some historical precedent for that. The 1918 Spanish flu occurred in waves, and the second one of those was considerably more deadly than the first. Of course, conditions back then were different in so many ways, including the ability to transmit information and to communicate long distances. It was nothing back then like it is today. Anyway, we can expect a resurgence according to the experts. Again, more indications that we're looking at a long, protracted process that will not end in weeks, but many months, potentially more than a year from now. But anyway, let me get back to this letter that the governor sent to the vice president. This recovery can only happen safely, however, with the assurance of a strong national testing system that does not exist today. I'm concerned by the view expressed by several administration officials on April 20th that testing in the United States is already adequate for states to begin initiating recovery plans. Simply put, this view is not consistent with the facts on the ground, this according to Governor Inslee. Scientists are indicating that testing levels must significantly grow over the coming weeks, reaching volumes not possible with the current resources before we can responsibly modify interventions that remain our best defense against the virus. Now, let's talk about that for a second. Mitigation does not end the virus. It contains it. It stops us from spreading it to one another. But there's no vaccine. There's no vaccine. People staying at home is not going to eradicate the virus. It's still out there. It sounds a bit like I'm arguing for the continuance of these mitigation efforts, but I've heard people out there say that the reason for the stay-at-home order was to avoid the overwhelming of our hospital facilities nationwide. And what moves have we seen? We've seen places like CenturyLink Field up in Seattle and the Javits Center in New York being turned into makeshift hospitals. We've seen the mobilization of those two enormous hospital ships, one on the East Coast in New York, the other one down in Los Angeles. But we've also seen the one up here in Seattle at CenturyLink Field was never even used. So the mitigation efforts seem to have been tailored to avoid the overcrowding and the overwhelming of hospital facilities, something which has not come to pass. More on that in a little while. Our testing system, according to Governor Inslee, is only as strong as its weakest link. On April 20th, your administration provided governors with a list of in-state laboratories in an attempt to illustrate states' apparent existing capacity. But this does nothing to answer the repeated calls from governors to address the lack of swabs, viral transport media, reagents, and other supplies and personnel needed to take advantage of that lab capacity. Now, earlier on, within this whole thing, it was not about test or testing supplies, which are relatively, how should I put it, low tech, especially as compared with ventilators. Ventilators that were portrayed as these things, these machines, these high-tech machines that if they were not available to a patient who was sick, then that patient was sure to die. Hence the Defense Production Act, hence requiring certain manufacturers to stop making their products and begin making ventilators. Well, we have so many ventilators available now that even Governor Inslee here shipped 400 of these things back to the federal government because it was determined we didn't need them. So he's sending back 400 of these high-tech, difficult-to-manufacture machines because they were more than we needed by a lot, but he's worried that swabs, etc., are going to be difficult for the state to procure. Now, this letter continues for a while, and here we have a list of the things that Governor Inslee believes it is the responsibility of the federal government to supply to this state and to other states. In order to rapidly build the robust testing system that we need, the federal government should, 1, provide significant flexible emergency funding to rapidly accelerate the underfunded testing system, create a new at-home testing program for those without access to reliable transportation, and support small laboratories that are still facing significant constraints. 2, assure an adequate supply of collection swabs and viral transport media or saline media production and distribution, including usage of Defense Production Act to mandate the manufacturing of swabs by additional procedures. 3, ensure the supply chain of additional high-throughput testing platforms and the reagent supplies to use them are at full capacity. 4, standardize the process of laboratory analysis, including by setting a standard price for all molecular, viral PCR, and laboratory tests, and mandating a universal requisition form for all laboratories to accept. What am I at? 5? So 6, create backstop capacity to ensure fair access testing for vulnerable communities experiencing barriers to testing, including rural communities, communities with a language barrier, and communities that are underinsured or otherwise underserved by the health system. 7, provide validation, authorization, and guidance for safe and accurate home self-swab testing, and consider other regulatory options for expanding rapid testing options. What did I say? 7. 8, conduct additional surveillance testing nationally to probe for hotspots, focusing on states with lower levels of testing. And 9, validate and assess role for serological tests. And then he concludes his letter with the obligatory pleasantries. So what? Yeah, 1, 2, 3, 4, 5, 6, 7, 8, 9 stipulations that Governor Inslee is insisting the federal government must fulfill before he can begin actively and solidly planning for the reopening of Washington. So he goes on television last night and he offers this big giant statement which has no substance to it at all. It was all just fluff. There was nothing in it. And then he sends this letter to the White House saying that there's these 9 things that the government must do to his satisfaction before he can do anything. Now, as you can imagine, that's not sitting with a lot of people here in the state. This is from RittsvilleJournal.com. And this is from also yesterday. Commissioners unanimously reject stay-at-home quarantine, citing Revised Code of Washington, Title 43, Chapter 6, Section 220, Subsection 4. Inslee, your time is up. Governor Jay Inslee's time has expired, at least in Franklin County. 5 minutes into the county commissioners' 9 a.m. meeting on April 21st, yesterday, commissioners voted to unanimously reject provisions under Governor Jay Inslee's stay-home quarantine order. Commissioner Clint Dieter, moved to reopen the county. The motion was seconded by Commissioner Brad Peck. I quote, I move that Franklin County end recognition of the governor's stay-at-home emergency proclamation that is now deemed unconstitutional. We support the reopening for all builders and small businesses that want to work. Now, this story goes on, but it's being echoed by other people, other officials across the state of Washington, not just in Franklin County. I also read that Snohomish County is starting to look at defying what the governor is saying he wants to do. There's a lot of backlash. People are getting fed up with this. Right here in my home state of Washington, which is a very, very liberal place, not homogeneously, but there is an overriding liberal ideology in the state of Washington. And there are county officials. Snohomish County, I used to go through and give county by county figures. King County's in first place for the most cases in the state of Washington. Then there's Snohomish County, followed by my home county of Pierce County. Snohomish County, there are sheriffs, I want to say, who have announced they're not going to enforce these restrictions. Well, it's starting to happen all over the place. There are people writing stories on like mynorthwest.com talking about how hypocritical the governor has been on the coronavirus protests, for instance. This is happening all over the country. There was a governor, I want to say the governor of Georgia, has announced that he is going to allow whatever businesses want to reopen. And this is drawing massive backlash from people in the media. People are getting fed up with this. Now, there's an angle to this that I touched upon in a piece that I wrote and then read aloud here on this broadcast not too long ago. It's about just the way that this whole lockdown and the way that this whole situation is affecting people on a moral and emotional and psychological level. And this is not an obscure reality. People are aware of this. This is a tweet by a doctor by the name of Nicole Sapphire, I want to say it's pronounced. As unemployment approaches 20%, each 1% rise can result in a 3.3% spike in drug overdoses, a 1% increase in suicides. If unemployment hits 32%, roughly 77,000 Americans may die as a result. Will economic fallout mortality be greater than the virus itself? An increase in drug overdoses, a certain increase in drug and alcohol consumption, an increase in suicides. People don't want to stay home. People don't want to not work. Some people do, but I think the vast majority of people want to get out there and carve their lives out, carve some happiness out for themselves. They want to do it proactively. They want to be in control. That's what freedom is in the minds of a lot of people. It's not sitting around not being punished for being lazy or being allowed to do drugs or other things. It's the ability to go out and make something of yourself proactively and on your own terms. That's what freedom is in the minds of a lot of people. Inexorably tied to the corresponding responsibility. That's what it means, in my mind, to most people, especially people who have experienced success in their own endeavors and have enjoyed the rewards that come with it. In many cases, intangible, but nonetheless very, very real. So it's not just county commissioners and other officials whose defiance of this whole thing has begun to manifest. This is a rather amusing story out of California. So state officials down there, or rather county or city officials in San Clemente, were upset that people were defying the stay-at-home orders, specifically young people, by going to a skate park. So kids are bored, they want to get out, they want to have some fun, so they're going out skating. They're going to a specific skate park in San Clemente. So how does the San Clemente government react to this? By filling the skate park full of sand. I don't skate. I've never had the coordination to be able to, but a lot of my friends have been, so I've gone to various skate parks just to watch them do their thing. It's fascinating. People who are really good at skateboarding, it's awesome watching them. They have an agility and an athleticism, but all of that's transcended just by the casual sort of attitude that they take to doing it. They just seem completely at ease and completely fearless. It's fascinating. It's very admirable to watch. So anyway, kids want to go out and they want to do this. So the city comes in and dumps 37 tons of sand into a skate park, filling it up so it can't be used. Now, doesn't it piss you off just hearing that? I mean, first of all, that park's owned by somebody, and the surfaces of these half pipes and bowls, etc., in which the kids are skating, they have to remain somewhat smooth, don't they? So isn't there cause for concern that dumping a bunch of sand into these things is going to hurt them? Damage the surface? Who's going to pay to have that fixed, and how long is it going to take to do that? So people are arguably upset about it. So this is funny. This is a story from from the San Clemente skate park issue. The quarter pipes and bowls where skaters usually shred were covered with sand, so dirt bikers showed up to play with their toys. Local skaters were irked and also asked if such drastic measures were needed to keep people out of the park. City officials said they looked at what other communities were doing and got the sense fencing wasn't going to be enough of a deterrent. They also said the sand shouldn't cause long-term problems, but they can't predict that. So people start showing up to these sand-filled skate parks with their dirt bikes. Instead of skating, they're biking through them. That's hilarious. I think that's awesome. Also, people started just digging the sand out. So people showed up with their shovels, etc., and unburied the skate park because they're like, no, fuck you. We're not going to do this. We're not going to let you get away with doing it either. So I wanted to share that because that's a level of defiance with which I and a lot of my friends can relate directly. Now, on a larger level, as I mentioned, Governor Inslee is all in with the mitigation, all in with extending the mitigation. And there's a lot of other governors who are as well. But some governors are not. And I think I mentioned it was the governor of Georgia. His name is Governor Brian Kemp, and he's decided to begin restarting Georgia's economy, which has drawn swift rebukes on Tuesday from mayors, public health experts, and some business owners, with skeptics arguing that the plan might amplify another wave of coronavirus outbreaks. Dr. Fauci said that this could be setting us back, and the New York Times, the headline about that article or about this issue, quote, "I am beyond disturbed," unquote. So the governor of Georgia is looking at the other dimensions, not just the economic dimensions, but also the dimensions such as the one that I cited in that doctor's tweet about the way that this could be psychologically and morally affecting the people of the United States. Drug use, suicide, depression. Add that to the economic impact of the lockdown. Add that to the growing defiance that we're starting to see pop up all over the country, the protests, the open acts of defiance. He's making the decision that the citizens of his state are not stupid, and their behavior does not need to be micromanaged to the extent of what we're seeing in many places. I'm glad that here in Washington, the restrictions are not as bad as they are in other places, such as Michigan, where Governor Whitmer is prohibiting the purchase of paint and the purchase of seeds and gardening supplies. I'm glad it's not quite that bad, but here in Washington, it's bad. It's bad, and the only response, as I said at the beginning of this broadcast, the only response we're getting from the governor is just an attempt to placate us, an attempt that's totally devoid of any real substance. Nothing definitive, no timelines, just more of the same. And other governors aren't having it. Now, this governor is getting backlash. I mean, front page of the New York Times, or at least a major headline within the New York Times, beyond disturbed. There are other, this is from Politico, Southern governors create a COVID-19 coalition, and experts fear a perfect storm. I'm going to dive into that one just a little bit. Unlike their peers in New York, New Jersey, and other northeastern states that have been working cooperatively since last week to restart their economies, the 6 in the South have lagged on testing and social distancing measures. Quote, if you put these states together, there is a perfect storm for a massive epidemic peak later on. Peak, I keep hearing that word. The West Coast states, Washington, Oregon, and California, were said by Dr. Deborah Birx at one of the coronavirus task force press briefings recently that in these states, including my home state of Washington, there has yet to be a peak. And our mitigation efforts are being used as a model to show how effective it's been. But does that mean a peak is still on its way? Or are we already starting to see a decline? I'm not sure. Anyway, back to the Politico story. If you put these states together, there's a perfect storm for a massive epidemic peak later on. The Southeast region is not known for having the best health record. Diabetes and heart disease come to mind. I'm very concerned about how our states will do it. Well, I read that and wanted to take a look at the figures from those states. So, of the southern states, 2 of them do show figures that are worse than what we're seeing here in Washington. Looks like, again, Washington State is 12,282. Georgia, 20,166 with 818 deaths. Louisiana, 24,854 positive or confirmed cases with 1,405. Okay, so other southern states: North Carolina, Alabama, Mississippi, South Carolina, and Arkansas. Alabama has 5,356 cases with 191 fatalities. North Carolina, 7,333. Mississippi, 4,716 with 183 fatalities. Arkansas, only 43 fatalities out of 2,262. So the governors are drawing upon a lot of information to make their decisions of how locally they want to address their particular situations. They're making their decisions as well as they can, and they're drawing outrage and ire from national news media outlets. Atlanta Journal-Constitution: Kemp eases coronavirus restrictions. Businesses ask what's next. On Monday, Kemp made the controversial decision to restart the state's economy by allowing some businesses to start up operations again. An important observation. The governor of Georgia is not demanding, ordering, or requiring any of these states to open, nor is he demanding, ordering, or requiring any citizens to go into these businesses and buy anything. He's just saying, if you want to, we won't stop you. And he's getting all this hate from everyone. Well, we can expect more of this to continue. We're hearing a lot of news right now, a lot of noise about testing. And I came across this kind of disturbing story. CDC's failed coronavirus tests were tainted themselves with coronavirus. The tests themselves had coronavirus. Think about that. As the new coronavirus took root across America, the United States Centers for Disease Control and Prevention sent states tainted test kits in early February that were themselves seeded with the virus, federal officials have confirmed. The contamination made the tests uninterpretable, and because testing is crucial for containment efforts, it lost the country invaluable time to get ahead of the advancing pandemic. The CDC had been vague about what went wrong with the tests, initially only saying that a problem in the manufacturing of one of the reagents had led to the failure. Subsequent reporting suggested that the problem was with a negative control. That is, a part of the test meant to be free of any trace of the coronavirus as a critical reference for confirming that the test was working properly overall. What if somebody who was negative, what if somebody who was healthy took the test and got sick from it? Think about that. That's oof. So this thing just continues to get more and more and more ridiculous. There's a lot of information coming out. A lot of information that I'm sitting around reading, printing out, studying, etc. I had to go out and buy a new ream of printer paper this morning because I've already burned through almost 500 sheets of this stuff. And I'm keeping everything I print out organized and filed away someplace. But there's a lot happening with respect to how the information is being gathered, the information that is informing our decisions. Decisions about how our lives are being controlled and restricted, how this information is gathered, where it's coming from, how unreliable it might be, such as my mentioning yesterday, the seroprevalence surveys, which are suggesting that a lot more people have caught this virus and recovered from it than was previously thought. And one thing that bears pointing out that doesn't get said a whole lot in all of these news conferences, public statements, and articles that I read, 98% of people who catch coronavirus get better from it, and relatively quickly. Why can't they go back to work, huh? Anyway, the number of people who recover from it might be way higher than that, based on the seroprevalence surveys that I talked about yesterday. These models, these projections, they have yet to be accurate. They keep getting sort of quietly revised, and when the numbers get revised, the projections, all the way the highest at 2.2 million dead in the United States alone. We've only just passed 2.2 million active cases worldwide. But the earliest projections anticipated 2.2 million people dead from this disease. Now we're looking at under 60,000 as a projection. And in the United States, we're sitting at just over 45. These projections and these models are the source of information and metrics upon which government officials have drawn to implement mitigation efforts. And they vary and change, or they're in such a constant state of flux as to be completely unpredictable and unreliable. But this doesn't seem to be concerning anybody, at least not anybody within what is regarded to be the acceptable school of thought with respect to how we're handling this. Again, there are those who are benefiting by this and who want it to continue. And they are the same people whose opposition to our current government and our current administration has been rampant and rabid and unrestrained and just tireless. The coronavirus outbreak seems, from my point of view, to be just the most current vehicle within which this same strain of opposition is conveyed. It's hard to look at it that way when you're talking about something that has cost so many lives, real lives. These are actual people who are dying from this. There's no denying how serious this is. But that makes it all the more egregious to want to pounce on it as an opportunity to push forward your own ideological ambitions. As I said yesterday, when this whole thing is over, we're going to have a chance to re-examine this situation in retrospect. It's one of the reasons I hold on to every article I read, every graph of numbers that I print out. I keep it. Because at some point, a couple of years from now, we're going to be looking at this whole thing through a completely different lens. And I want to be able to have a real-time documentation of how this thing was being reported and characterized in real time, so that I can go back and look and compare this to what is to come when we examine this in retrospect. Thanks for everybody who listened and who follows this stream. And there's more to come. So, thanks. Be good to each other.